I'm Nancy Cavey, National ERISA and IDI disability attorney. Welcome to Winning Isn't Easy. Before we get started, I've got to give you a legal disclaimer. This podcast isn't legal advice. The Florida Bar Association says I have to say it, and now that I've said it, nothing will ever prevent me from giving you an easy-to-understand overview of the disability insurance world, the games that disability carriers play, and what you need to know to get the disability benefits you deserve. So off we go. Unfortunately, the COVID virus is still with us, and so is long COVID. In this episode of Winning Isn't Easy, we're going to update you on how disability carriers are handling long hauler COVID claims and the denial tools that they're using in their denial toolbox to wrongfully deny or terminate benefits. I'm going to be talking about 5 things today. First, the common types of cases that we see from long COVID syndrome, aggravation of underlying diseases because of COVID, and new medical conditions caused by long COVID. 2, the 7 denial tools that carriers or plans use to justify a claim denial or termination and how courts have viewed these denial tools. 3, the role of your physician in your long COVID claim and your post-COVID functional status. 4, vocational denial tools. And 5, 13 tips for attacking the denial or termination of your long hauler COVID claim. Got it? We've got a lot to cover, but before we get started, we're going to take a quick break. Okay? See you in a minute. Welcome back to Winning Isn't Easy. Let's talk about the common types of cases that we see from long hauler COVID, aggravation of underlying diseases because of COVID, and new medical conditions we find that are being caused by COVID. When I am talking with a prospective client and listening to their story, I'm really trying to initially break down what it is I have in terms of the medical sequelae of long COVID. So let's first talk about the common types of cases due to long COVID that I see that really run the gamut. And they can be individual symptoms or they can be a combination of symptoms. But I'm doing this sorting, if you will, in my head as I'm listening to my client's story. So the first common type of causes due to long COVID can run the gamut. I see pulmonary issues such as shortness of breath, cough, decreased exercise tolerance, cardiac issues, including chest pain, palpitations, and even lower extremity swelling, neurological issues such as brain fog, memory loss, loss of taste and smell, tingling of extremities, insomnia, and fatigue. I'll also see gastroenterological issues such as acid reflux, GERD, common diarrhea, and even kidney issues. I'll also see psychiatric issues such as depression and anxiety, and maybe even post-traumatic stress disorder. Obviously, there's neurocognitive issues. That can be difficulty thinking, brain fog, short-term memory deficit, concentration issues, and even visual spatial difficulties. And then there's a category I call other. That's a big other category, but it can include body and joint pains, relapsing fevers, headaches, weight loss, and multi-organ effects. So I'm listening to, what's the constellation of the symptoms? Then I'm listening for conditions that my clients may have had that have been aggravated by COVID. And then I'm listening for information about new conditions arising because of long COVID. So conditions aggravated by long COVID include GERD. They can include immunological issues that people have had. They can also include things like EBV. Epstein-Barr virus. So I'm listening to that story and saying, okay, well, my client had these pre-existing conditions. Has there been any change as a result of having COVID? And if so, what are those changes? Has that condition been aggravated? Has that aggravation ended? As that aggravation continued, have the symptoms become more symptomatic or more frequent? The third thing I'm listening for are new conditions that are arising because of long COVID. Now, in addition to an aggravation of GERD, I'm also listening for diagnoses like Barrett's esophagus, which ultimately can become cancerous. I'm listening for an issue of trigeminal neuralgia, which is a chronic pain condition that affects the trigeminal nerves that carry sensation from your face to your brain. I am listening for issues with POTS. I am listening for issues involving mast cell aggravation or syndrome. And I am also listening for the EBV, not an aggravation of, but an actual onset of EBV. So when you are talking to your physicians, I strongly suggest that you kind of divide it into those three categories. If you've had a pre-existing condition that's been aggravated or accelerated by long COVID, you need to talk about those baseline symptoms you had before COVID, and then how they've changed after: intensity, frequency, duration, location. If you have complications from long COVID of any systemic nature, you want to talk about those symptoms, but you want to talk about them by body system: pulmonary, cardiological, urological, neurological. So you want to kind of classify them by body system and talk about the symptoms and functionality. And then, of course, if you have something new that is post-COVID, new diagnoses of, as I said, something like POTS or mast cell syndrome, you need to be talking to your doctor about that. I like this discrete breakup, if you will, of these medical conditions with a history of symptoms and functionality. This is really going to be important in developing your claim or ultimately dealing with a wrongful denial or termination. Most likely, you're going to be required to apply for Social Security disability benefits. And obviously, you should be hiring a lawyer who has a specialty in both, in my opinion. But that history is also going to be significant in the Social Security disability claim. So think about that as you are approaching how you want to apply for disability or your Social Security disability benefits. Got it? Let's take a break.